Problems in healthcare often have multiple causes, and solving them starts with identifying which issues have the greatest impact. Leaders at AHS know all too well the overwhelming feeling of managing multiple issues and having to interpret large amounts of data and information. Examining measures or data using the appropriate graph, or what we like to call making meaning from evidence, can help you zero in on the key issues and begin to prioritize and analyze information so you can kickstart quality improvements and improve patient safety. A Pareto chart is a good tool to identify the biggest contributors or vital few factors that are a priority for attention. Here you can see the different types of issues at this hospital. By seeing this data in a Pareto chart, you can easily see, by volume, which issues are more significant. A Pareto chart has categories listed on the bottom or x-axis, the count on the vertical or y-axis, and the data groupings are ordered from largest to smallest. Percentage is placed on the right vertical axis, and often a cumulative line is added to show the cumulative percentage of the issues that make up the problem. This line and the 80-20 rule are used to help determine where to put improvement efforts. So what is the 80-20 rule? The 80-20 rule, also known as the Pareto principle, states that 80% of the problem comes from only 20% of the causes. When looking into a problem, the first step would be to identify the various causes. Then, when you collect and analyze data for a specific period of time on how many times those causes actually impacted the problem, you will see that roughly 80% of the problem comes from only 20% of those causes. A Pareto chart is an excellent way to graphically see the 80-20 rule in action. By plotting your findings for each cause on the Pareto chart from largest to smallest, you will see that roughly 20% of the causes makes up 80% of the problem. Based on this, you can begin to determine where to allocate your time and resources. Now that you're able to see what the top causes of the problem are, a Pareto chart can also be used to examine each cause even further to identify root causes. By breaking up the problem in this way, you're better able to pinpoint the biggest contributor so that you can allocate resources, such as time and staff, to improvements with the greatest impact. Here is a Pareto chart you may encounter in your role. Think about the 80-20 rule. What can you conclude? Where might you want to start to make improvements? Did you say, together the emergency, surgery, and medicine program areas make up roughly 80% of the concerns volume? And since the highest number of concerns comes from the emergency program, this might be a first place to start to look to make improvements. With this information, you may want to refine the data even further to uncover the root causes. If we drill down on emergency concerns, where might you want to start to look to make improvements now? Did you say you would look at the issues regarding practice standards, communication style, wait times, diagnosis and assessment, and care plan? Were these the root causes you suspected? A Pareto chart is a good tool for you to use when you need to identify the biggest contributors or vital few factors that are a priority for attention. In addition, it is also one of the many tools used in the Build Understanding step when using the AIW method for improvement. In AHS, leaders are able to access data for a specific area or project through a number of sources, such as RLS, FAC, Statit, and Tableau. If you require assistance using these or require additional support, AHS Clinical Quality Metrics is a great resource to support the design and development of measures and strategies to help clinical teams obtain and use data to improve quality. Also, Process Improvement and Clinical Quality Improvement collaborates with staff, medical staff, and patients to improve clinical processes provincially and within each zone. All of these groups can be found on Insight. Thank you, and good luck making meaning from evidence.